smell hit us before we even reached the beach. Salt water and cordite and something else, something sweet and rotten that made your stomach turn. Death. We were still half a mile offshore and we could smell death. That's what I remember most about June 10th, 1944. Not the anticipation or the fear or the sense of purpose, just that smell. My name is Margaret Walsh, First Lieutenant in the Army Nurse Corps, and I'm 28 years old. 4 days ago, thousands of men stormed these beaches in the largest invasion in history. Now I'm coming ashore with the medical units, and I already know that everything I've seen before, everything I thought prepared me for this, was just practice. I grew up in Philadelphia, daughter of a doctor who ran a practice in the Polish neighborhood. I'd spent my childhood watching him work, seeing him save lives, and I knew from age 10 that I wanted to be a nurse. Went to nursing school at Pennsylvania Hospital. Graduated in 1938, worked trauma and emergency for 3 years before the war. When Pearl Harbor happened, I knew I had to go. My father tried to talk me out of it, said I could serve just as well at home. That war was no place for women. My mother just cried and held me, but I enlisted anyway. January of 1942, 2 years and 6 months ago. Feels like a lifetime. They sent me to England in 43, assigned me to the 128th Evacuation Hospital. We trained for the invasion for over a year, practicing setting up field hospitals, treating mass casualties, working under combat conditions. They tried to prepare us for what was coming. You can't prepare for what's coming. The other nurses in my unit became my family. Captain Elizabeth Morrison, head surgical nurse, 35 years old, had been nursing since the Great War. Lieutenant Sarah Goldstein from New York, quick with a joke, steadiest hands I'd ever seen. Lieutenant Patricia Chen from Los Angeles, barely 23, youngest in our group, but fierce as hell. And Lieutenant Mary O'Brien from Boston, Irish Catholic, could pray in Latin while doing an emergency tracheotomy. We'd been waiting in England for months, knowing the invasion was coming, not knowing when. When D-Day finally happened on June 6th, we weren't part of the initial wave. The combat medics and surgical teams went in with the troops. We evacuation hospitals would follow once the beachhead was secure, once they had space to set up proper facilities. Secure was a relative term. On June 9th, they told us we'd be loading onto transport ships the next morning, landing at Omaha Beach, setting up a field hospital a mile inland. Expected casualties, hundreds per day, maybe thousands. We'd be operating within artillery range, within possible German counterattack range. Sleep would be optional. Breaks would be rare. Captain Morrison gathered us the night before we shipped out. Her face was grave, and I'd never seen her look scared before. That night, she looked scared. "Ladies," she said, "tomorrow we go into hell. What you'll see will be worse than anything you've experienced. Boys with limbs blown off, faces destroyed, internal injuries that would make a civilian hospital stop and think. We won't have time to stop and think. We'll have minutes to decide who lives and who dies. Make your peace with that tonight, because tomorrow there won't be time." I tried to sleep that night. Couldn't. None of us could. We lay in our bunks, listening to each other pretend to sleep, each alone with our thoughts about what was coming. I thought I was ready. I'd worked trauma. I'd seen gunshot wounds, car accidents, industrial injuries. I thought I knew what blood and suffering looked like. I knew nothing. June 10th, 1944. 4 days after D-Day, we loaded onto LSTS, landing ship tank at dawn. 100 nurses and medical personnel, plus all our equipment. Tents, surgical supplies, generators, everything needed to run a field hospital. The crossing took 6 hours, and I was sick for most of it. The channel was rough, and the landing craft pitched and rolled. As we got closer, we could see the beach, Even from offshore, you could tell something terrible had happened there. The water was still dark with fuel oil. Debris floated everywhere. Wood, metal, things I didn't want to identify, and bodies. The graves registration units were still working, still pulling the dead from the water and off the beach. The LST couldn't get all the way to shore. The beach was still cluttered with obstacles, destroyed vehicles, wreckage. We had to transfer to smaller landing craft for the final approach, climbing down cargo nets in full gear, trying not to fall into the water between the ships. Sarah Goldstein was ahead of me on the net. She looked back, gave me a smile that was all nerves. Just like training, right? Right, I said. It wasn't like training at all. The landing craft took us in. As we got closer, the smell got stronger. Salt and oil and decay and something else I couldn't identify, but made every instinct scream to turn back. The beach was chaos. Vehicles everywhere, supply dumps, men working to clear obstacles, and scattered among it all, the evidence of what had happened here 4 days ago. The ramp dropped. Cold water rushed in around our boots. We waded ashore, and I tried not to look at the high water mark, where you could still see the stains, could still see where men had fallen and bled into the sand. Captain Morrison was shouting orders. Move! Keep moving! Get to the assembly area! Don't stop! Don't look around! Just move! We moved. Up the beach, past destroyed bunkers still smoking, past craters from naval bombardment, past the marks of battle that were still fresh. My boots crunched on something. I looked down. Brass shell casings, thousands of them. The beach was carpeted with spent ammunition. At the top of the bluff, they'd set up a temporary aid station. That's where we got our first look at what we were dealing with. Wounded men everywhere, lying on stretchers, sitting against walls, some just on the ground, waiting for treatment. Blood everywhere. The smell of gangrene and disinfectant and fear. A medic with 1,000-yard stare pointed us toward a field a mile inland. Hospitals going up there. You better hurry. We've got more wounded than we can handle. Been sending them to England, but the ships are full. They're backing up. We moved inland. The countryside was beautiful. Green fields, hedgerows, Norman villages that looked like postcards. Except for the shell craters, the burned-out vehicles, the hastily dug graves marked with rifles stuck in the ground. Our hospital site was a field next to a half-destroyed farmhouse. They'd already started setting up tents. Surgical tents, recovery tents, supply tents, the whole complex. We had maybe 3 hours to get operational before the wounded started arriving. We worked like machines, setting up cots, organizing supplies, sterilizing equipment, establishing the flow from triage to surgery to recovery. Captain Morrison ran it like a drill sergeant, barking orders, keeping everyone moving. By 1500 hours, we were ready as we'd ever be. The first ambulances arrived at 1530. They didn't come in ones or twos. They came in waves. Dozens of ambulances, trucks, jeeps, anything that could carry wounded. The triage area filled immediately. Men with gunshot wounds, shrapnel wounds, blast injuries, burns, some walking, some on stretchers, some already dead, but nobody had time to notice. Captain Morrison took charge of triage. She walked through the wounded with quick, efficient movements, marking foreheads. Black for those too far gone to save, red for immediate surgery, yellow for urgent but stable, green for walking wounded. I watched her mark a boy's forehead with black. He couldn't have been 19, had a sucking chest wound, was coughing up blood. He looked at her with understanding in his eyes, knew what that mark meant. "I'm sorry, soldier," she said quietly, then moved to the next one. I followed her, trying to learn, trying to understand how she could make those decisions so quickly, how she could look at a boy and decide he was going to die. "Lieutenant Walsh," she said, "take the red tags to surgical." "Move." I grabbed the first stretcher, Private James Miller from Ohio, both legs mangled by a mine, left arm partially severed, going into shock. He grabbed my hand as we moved him. Am I going to make it? His voice was weak, terrified. Yes, I said. I didn't know if it was true, but it's what he needed to hear. We got him into surgical. Lieutenant Goldstein and 2 doctors were already working on another patient. I'd never seen surgery done so fast. No careful preparation, no discussion, just cut, clamp, suture next. They amputated his left arm in under 10 minutes, started working on his legs. We're going to try to save the right one, the doctor said. Left's too far gone. Get him ready for transport to England after we stabilize him. I moved to the next patient, and the next, and the next. The wounded kept coming. The surgical team worked nonstop, and we nurses moved between them, prepping patients, monitoring vitals, starting IVs, administering morphine, doing whatever needed doing. By 2,000 hours, we'd treated over 200 casualties. The surgical teams had been operating for 4 hours straight. The recovery tents were full. We'd sent 3 black-tagged patients to the tent we'd designated for the dying, the ones we couldn't save but couldn't let die alone. That's where I found myself at 2,100 hours, the dying tent. 6 boys, all under 25, all marked black, all fading. Corporal Daniel Foster from Georgia, abdominal wound, intestines damaged beyond repair. He was conscious, knew he was dying. Can you write to my mother? He asked. Tell her I wasn't scared. But he was scared, terrified. I could see it in his eyes. I'll tell her, I said. What do you want me to say? He told me about his family, his farm, his girl back home, talked until he couldn't talk anymore, until the pain and blood loss took him. I held his hand while he died, wrote down everything he said so I could send it to his mother. I did that 5 more times that night. The days blurred together. Wake up, work 16 hours, grab a few hours sleep, wake up and do it again. The wounded never stopped coming. From the beachhead, from the hedgerow, fighting inland, from the constant grinding combat as we pushed deeper into France. We lost our first nurse on June 13th. German artillery hit the hospital compound. Most of the shells landed in open ground, but one hit the supply tent. Lieutenant Patricia Chen was inside, organizing medications. The explosion killed her instantly. 23 years old. Made it through nursing school, through training, through 4 days in Normandy, killed by random artillery fire while organizing bandages. We buried her in the military cemetery they'd started near the beach. Captain Morrison said a few words. We all cried. Then we went back to work because there were wounded waiting. You learn not to feel after a while. Have to, or you'll break. The boys with missing limbs, destroyed faces, the ones who scream for their mothers while you're trying to save them. You stop seeing them as people and start seeing them as medical problems to solve. Arterial bleed to clamp, fracture to stabilize, infection to treat. It's the only way to function. Lieutenant Mary O'Brien couldn't make the transition. She was a good nurse, competent and caring, too caring. She took every death personally, cried over every boy we lost. By June 20th, she was having panic attacks between shifts. By June 25th, she had a complete breakdown. Just stopped working mid-surgery, started sobbing, couldn't stop. They shipped her back to England. Last I heard, she was in a psychiatric ward. The war broke her, and she never even saw combat, just saw what combat does to boys. I understood completely. Some days I felt like I was on the edge of that same breakdown. The only thing that kept me going was the work. As long as there were wounded, I had purpose. It was the quiet moments that were dangerous, when you had time to think, to remember all the boys you'd watched die. Sarah Goldstein became my anchor. We'd work together, sleep in the same tent, cover for each other when one of us was about to break. She had this dark sense of humor that kept us sane. You know what the worst part is, she said one night after a particularly brutal shift. We're getting good at this. I can assess a trauma patient in 30 seconds now. Know immediately who'll make it and who won't. That's not a skill anyone should have. She was right. We'd become efficient at processing human suffering. Could look at a 19-year-old boy with half his face blown off and immediately calculate the resources needed to save him. Could walk past a dying soldier because we knew our time was better spent on someone with better odds. That efficiency came at a cost. We were losing our humanity piece by piece, patient by patient. July 4th, 1944, 1 month since D-Day. Back home, people were celebrating Independence Day. Here we were elbow deep in blood, trying to save boys who'd fought for that independence. The surgical tent was sweltering. Summer in Normandy, no air conditioning, just heat and flies and the smell of blood and disinfectant. We'd been operating for 12 hours straight. The surgeons were exhausted, making mistakes. One patient died because a doctor's hand slipped, cut an artery he didn't mean to cut. The boy bled out in minutes. The doctor just stood there, staring at his bloody hands. I killed him. I was too tired, and I killed him. Captain Morrison pulled him out, got another surgeon in. The work couldn't stop. We'd mourn later. I was assisting with an amputation when the new casualties arrived. 12 men from the same unit, hit by artillery, brothers in arms, some literally brothers. 2 of them were actual siblings, last name Thompson, from somewhere in Kansas. The older brother, Sergeant Robert Thompson, had shrapnel in his chest and abdomen, survivable injuries but complicated. The younger brother, Private David Thompson, had been hit worse. Missing his right leg below the knee, left leg badly damaged, losing blood fast. We put them next to each other in surgical, different teams working on each. I was with David, the younger one. He kept asking about his brother. Is Bobby okay? Tell me Bobby's okay. He's fine, I said. I didn't know if it was true. Just focus on you right now. We saved his life, amputated the right leg, stabilized the left, got the bleeding under control. He'd live. He'd walk again with a prosthetic. He was one of the lucky ones. His brother died on the next table. The shrapnel had nicked his aorta. The surgeon couldn't reach it in time. Robert Thompson bled out while his little brother was unconscious 10 feet away. When David woke up, he asked about Bobby immediately. I had to tell him, had to watch his face as he realized his brother was dead, had to hold him while he sobbed, watch him try to get up on his one remaining leg to go see the body, had to restrain him, sedate him, because there was nothing else we could do. That night, I sat outside the surgical tent and cried. First time I'd cried since Patricia Chen died. Just sat there in the darkness and let it all out. The death, the suffering, the utter futility of trying to put broken boys back together while the war just kept making more of them. Sarah found me, sat down next to me, didn't say anything, just sat there while I cried. After a while, she started crying too. We sat there together, 2 nurses who'd seen too much, crying for boys we couldn't save and boys we could save but who'd never be whole again. I don't know how much more of this I can take, I said. Me neither, but we don't have a choice, do we? They keep coming and we keep trying to save them. She was right, we didn't have a choice. It's been 3 months since we landed in Normandy. We're still here, still setting up and tearing down field hospitals as the front moves east, still treating hundreds of casualties every day, still watching boys die while we try desperately to save them. I don't know how many patients I've treated. Thousands, probably. Don't know how many have died. Hundreds, at least. I stopped counting. Stopped remembering names. Have to, or I'll end up like Mary O'Brien, broken and useless. But I remember some. Corporal Daniel Foster, who wanted his mother to know he wasn't scared. Private David Thompson, who lost his brother on the table next to him. Private James Miller from Ohio, who asked if he'd make it. Hundreds of others whose faces I can still see when I close my eyes. The Army says we're making good progress. The liberation of France is proceeding ahead of schedule. We're winning. But I don't feel like we're winning. I feel like we're drowning in blood and broken bodies, like no matter how fast we work, no matter how many boys we save, there's always more coming. an endless tide of casualties that will never stop until this war is over. I'm tired. So tired I can barely think straight sometimes. But I keep working because that's what we do. That's what nurses do. We show up, we do the job, we try to save the ones we can and make the dying comfortable. And we don't break because breaking isn't an option when boys are dying. Captain Morrison says I'm one of the best trauma nurses she's ever worked with. Says I stay calm under pressure, make good decisions, don't crack under the strain. She's recommended me for promotion. I don't feel calm. Inside I'm screaming, but I've learned to hide it, to function despite the horror, to keep moving because stopping means facing what I've seen. Sarah says we've changed, says we're not the same women who landed here in June. She's right, the bright-eyed nurses who thought they could make a difference, who believed in the nobility of their calling. Those women died somewhere in the surgical tents, drowned in the blood of boys who couldn't be saved. What's left is harder, colder, more efficient. We're good at our jobs, excellent even. But we've lost something essential in the process, some connection to our own humanity that you can't get back once it's gone. I don't know when this war will end, don't know how much longer I can keep doing this, but I'll keep doing it anyway because the alternative is abandoning these boys, and I can't do that, won't do that. So I'll wake up tomorrow and go back to the surgical tent. I'll triage wounded, assist with amputations, hold hands with the dying. I'll watch boys younger than me lose limbs and futures and lives. I'll write letters to mothers telling them their sons weren't scared, even though they were terrified. And I'll do it all again the next day and the day after that, however long it takes. This is what I signed up for, even if I didn't understand what it meant. This is the cost of serving, of trying to save lives in the middle of a war. You don't get to be the same person you were before. You don't get to unsee what you've seen or forget the faces of the ones you couldn't save. The nurses who landed in Normandy in June, the ones who thought they were ready, who believed they could handle it, those women are gone. We died on those beaches along with everyone else, drowned in the tide of blood and broken bodies and impossible choices. What came back is something else, something that can function in hell without breaking, that can make life or death decisions in seconds, that can watch boys die and keep moving to the next patient. We're not the same. We never will be. But we're still here, still fighting, still trying to save the ones we can. That's all we can do. That's all anyone can do.